as we understand what are those factors which are contributing to this increasing incidence and numbers, we also, therefore, they give you those portals or targets for intervention. So if I'm looking at alcohol use in young men and they're clustered in certain regions, then I'll have to get that awareness and improve the health-seeking behavior of the population. So it includes an intervention in terms of awareness as regards, the harmful effects of those lifestyle. So that needs to change. The other is we still have to contribute to better obstetric care, a better oral contraceptive usage in terms of, less estrogens and the upper grade of progesterones, not the level 1 but the level 2. And then we also have to look at the other lifestyles, so less of smoking and even the NCDs which are changing. Say for example, you have a young woman who's also hypertensive and is taking OCPs, is more prone to develop a CVT. So you need to have that strategized into this population. Deal with infections. Dengue is all over, and you have this polymicrobial. You have a dengue, on top of that you have, say, a scrub typhus coming in, or melioidosis, which is very common in southern part of India. So you have to deal with the infections control. And then something needs to be done about climate and environment. So I think there are verticals that you can improve upon anemia, try and take care of the nutritional aspects which may go into, again, lifestyle, as well as, awareness about that, don't look at your vitamin B12, look at your folic acid, look at your hemoglobin, which can be a mass, a kind of a mass screening and a mass strategy of intervention. And I think it starts with the change in your lifestyle, awareness, changing your perspectives to global changes in terms of climate, environment, throw in infection control and all these things and better obstetric practices. Probably that would help. And we haven't even talked about the genetics, because that's one vertical which is growing again in the evidence is also growing in terms of what kind of those are genetic markers which are predisposing to this. We don't have interventions there, but all the others that I've spoken about, they could be targets for intervention.